Hi everybody, it is Crohn's and Colitis Awareness Week this week, so I thought I'd do a little video around that because I have Crohn's disease, so I can only actually really talk to you about Crohn's disease, but I do believe that colitis is very similar. People don't talk about these diseases an awful lot because who wants to talk about pooping themselves in public? And sadly, that is the reality sometimes for those of us with Crohn's disease, and it's quite embarrassing, obviously, and it's all about the bowels, but also Crohn's disease has a lot more symptoms besides. And for me, I've had it probably since I was about 15. So by the time I was diagnosed when I was 25, I was at the stage where I needed a resection. So that's basically where they take a bit of the diseased bowel away and they put two healthy bits together. And then I've gone on to have a further resection as well. So I've had quite a few meters, I think about 2 and a bit, of bowel removed now. And what I do have left is kind of all ulcerated, and it all has Crohn's disease now. So the next stage for me is probably going to be a stoma at some point, but I also have Crohn's disease in the upper esophagus. So Crohn's disease can affect you anywhere throughout your digestive tract, which starts at the mouth and ends at the anus. When I'm in a flare, so basically what happens is Crohn's disease never really goes away. You can keep it in remission to some extent, but sometimes it'll flare up, and sometimes there is no reason as to why you've flared up and it's kind of kicked off. But the symptoms that I have when I flare up can vary, but they are mainly a mouth full of ulcers, and you might think, oh, it's just an ulcer, but I can promise you this is pain. It's not being able to drink very well, not being able to eat very well, having pain, having pus, having blood because they bleed as well. So that's generally one of the first signs that I get personally. I also get a lot of pressure in the back of my eyes. Crohn's disease is an inflammatory bowel disease, so the clues in the name, it has it means that your body is inflamed, but it's not just your bowel that's inflamed. It affects all of the inflammatory markers within your body. So you get joint pain, so it feels like you're basically riddled with arthritis. Sometimes because of that, and because your body's working so hard on the inside, I've often said it feels like you're being bullied from the inside out, and that can be absolutely knackerising because you can be sitting still, but your body's like busy doing all sorts of crazy shit inside. Autoimmune ultimately means that my healthy immune system is attacking healthy cells within my body because it thinks that they are rogue cells, and they're not. So things that boost people's immune system generally, like echinacea, can actually make me worse because it makes my defunct immune system work better, but not better for me because my healthy cells are already attacking healthy cells in the body. So can actually make Crohn's disease worse. So it's very, very difficult to manage in terms of keeping yourself healthy. So my body's ability to fight off normal general infections and bacterial infections and viral infections, things like coughs and colds and chest infections, for me can turn really nasty. So a chest infection is likely to turn into pneumonia, and the flu could actually kill me. I just don't have the ability to fight it off. I can have a cold, which I have had for approximately a month now. So the body just doesn't really work the way that you want it to. And let's be honest, it massively affects the bowel. So I can either not go for days, weeks, or I can go up to 20 times a day. I bleed quite frequently. If I haven't gone to the loo for a while, I can get what's called a stricture. So it's where one part of the bowel attaches to the other. So your bowel is basically a tube and one side will attach to the other. And then when you do eventually go, that obviously breaks. Sometimes it doesn't break, actually. Sometimes it causes a blockage, which you need hospitalisation for. But sometimes it breaks and then you get an awful lot of blood. So therefore also you can become anemic. But also you can become anemic because you malabsorb with Crohn's. Sometimes the transient time between you eating and it coming out is very quick, so your body doesn't actually have time to absorb all the nutrients from food that it needs to. Plus there's only a very small part of the bowel that actually takes iron from food and transfers that and makes it into B12. I don't have that, so I have to inject regularly with B12 in order for me to be able to get that nutrient or that vitamin on board. So therefore also you can become anemic because you malabsorb with Crohn's. Sometimes the transient time between you eating and it coming out is very quick, so your body doesn't actually have time to absorb all the nutrients from food that it needs to. Plus there's only a very small part of the bowel that actually takes iron from food and transfers that and makes it into B12. So I have to inject regularly with B12 in order for me to be able to get that nutrient or that vitamin on board. it affects me every single day, even when I'm not on a flare-up. So people often make comments as to why I don't work clinically more than I do, because I do two and a half, sometimes 2 full days and 2 half days of clinical work in clinic. And the reason why I do that is because if I'm having a good or a bad day, sometimes I don't know how my bowel's going to be. So on a work day, I get up approximately 2.5 hours earlier than I need to before I need to leave the house. I have generally a liquid breakfast. So I'll get the Nutri-Bullet and I'll put a load of good stuff in there, lots of protein, and whiz it all up. And then it's really easy for me to digest. Most of that is actually digested within the stomach. And then I don't eat at all for the rest of the day, for 2 reasons. One, because sometimes digesting food can be incredibly painful, and I need to focus on my job. I'm trying to help other people with their problems, and I can't do that if I'm in a huge amount of pain. Also, I might have to go to the toilet like 10, 20 times a day. I can't do that when I'm here with a patient, and I run back to back as well in order to cram as many in as possible, so that the other days where I don't work clinically and I'm working from home, or I'm doing everything else that I do, looking after Mum, Brian, hospital appointments for me, either regarding Crohn's or cancer or again whatever else is going on, which is quite a lot. It means that I've got the flexibility there to be able to use the loo a bit more often and eat a bit more regularly. If I'm away, then I'll sometimes take medication to stop me from going to the toilet, which just causes a huge amount of pain, but it also takes away the anxiety of thinking, fuck, where is a toilet round here? And then inadvertently stops me from shitting myself, because it's happened. It has happened, yeah. So there's no shame in it. It's absolutely awful. It's dreadful. That's why I always carry a spare set of clothes with me, pretty much, or if not that, always a spare pair of nicks in my coat pocket. So God knows if I was ever to be run over, what anybody would think about that. What are these? But you have to laugh, and you really do, because humour and a sense of hope and some positivity within it all is the thing that kind of keeps you going, and you just got to make the most of good days. And I'll be honest, my life is kind of a bit of a balance between lots of clusterfucks, because everything seems to go wrong a lot of the time, and then I balance that with a huge amount of fuck it moments, and that is ultimately, yeah, fuck it, let's just book the ticket, go there, let's just go on holiday, let's just do this, let's just do that. And I feel that is the way that I can cope with it. Anyhow, I'm going off tangent a little bit. So Crohn's disease is not fun. Obviously, it's a disease. I don't know many diseases that are fun. I don't know any that are fun. But if somebody tells you that they have Crohn's disease, or you find out, maybe you'll just know a little bit more about it now. Medication for Crohn's disease can sometimes work really well, and then it can sometimes just stop working, as it has in the main for me. You can get infusions where you go into hospital, you can self-inject, you can take tablets. There's lots of different ways, but sadly not many of them work that well, certainly not for me anyhow. They don't take it away completely, and just cutting the diseased bit out doesn't seem to take it away either, because then other parts of the bowel just become diseased as well. So it isn't just about the bowel, it's everything. It affects the whole lot. It affects your body's ability to function ultimately, and sometimes it can be absolutely exhausting. So yes, I hope that you understand a little bit more now, if you've managed to get this far, and I hope I haven't bored you to death. But yeah, that's what Crohn's disease is. I hope you don't have it. I hope you never get it. But if you ever come across it, hopefully you'll have a little bit more understanding of what somebody like me goes through. All right, take care. Bye.